Mild burns, such as minor first-degree burns, can cause redness, pain, and mild swelling. Immediately cool the affected area under cool, running water for about 20 minutes. Do not use ice, butter, or toothpaste. Over-the-counter options, such as burn gels or aloe vera gel, may help soothe minor burns, while paracetamol or ibuprofen may help relieve pain when appropriate. Cover the area loosely with a clean, sterile, non-stick dressing and do not burst blisters. Seek medical attention if the burn is deep, larger than the person's palm, located on the face, hands, feet, genitals, or over a major joint, or if it was caused by electricity or chemicals. Also seek care if there are signs of infection, such as increasing redness, swelling, pus, or fever.